Hello, my name is Tochukwu Ndukwe, and I am a fourth-year medical student at the University of Michigan Medical School. The title of my presentation is Michigan Ophthalmology Pipeline, Longitudinal Mentorship to Increase Diversity in Medicine. There's been an extreme lack of diversity in the field of ophthalmology. Approximately 30.7% of the US population are from minority groups who are underrepresented in medicine. There are about 18,000 practicing ophthalmologists with direct patient care, but only 6% are from groups underrepresented in medicine. Among ophthalmology residents, we see similar numbers with about 7.7% from URM groups out of 1,300. These numbers are very concerning, as we know that increasing diversity within the ophthalmology workforce would certainly improve the eye health of minority communities. There have been many studies showing that across all specialties, patients report improved communication and greater satisfaction with providers when their race or ethnicity is concordant. In addition, minority ophthalmologists are more likely to practice in underserved communities, improving much needed patient access. To tackle this issue, students and faculty at the University of Michigan Medical School and the Kellogg Eye Center developed the Michigan Ophthalmology Pipeline Program, or MOP. MOP launched in 2017 as a longitudinal mentorship program to support URM medical students, inspire and expose students to ophthalmology early on in medical school, and to make students competitive residency applicants. The program is currently in its fourth year, and it builds on a foundation of continuous mentorship between first-year medical students, PGY2 ophthalmology residents, and Kellogg Eye Center faculty to provide mentees with exposure to the field, educational support, a point person for questions and networking, and a faculty member to provide early research opportunities. It's important to mention that while we expose mentees to the field of ophthalmology, mentees are free to decide on any specialty they would like as we will continue to support them. In terms of the program structure, our program consists of mentees shadowing their resident or even faculty mentor in a clinic, operating room, and on a consult service. We have a clinical skills night to teach the basics of the ophthalmology exam, a suturing skills night to teach the basics of suturing, an IC surgical simulator to allow mentees to simulate eye surgery. In addition, we also have health disparities journal clubs and invite a guest lecturer to speak about DEI at our grand rounds. As we all know, COVID-19 brought about many challenges, especially for our program. Early on during the pandemic, our mentees were not able to shadow, and many of the skill building events we normally have for our mentees were canceled. COVID-19 forced us to really evaluate our program and rethink how we can continue to fulfill our goals and support our mentees. Some improvements we made to our program for this 2020-2021 academic year, providing mentees with faculty mentors, as we believe this is necessary to facilitate early relationships, early research opportunities, and a future strong letter of recommendation for residency, providing MBME practice exams for clinical rotations and board exams, as we would like to mitigate this financial burden for our mentees, open enrollment of our program to M3 and MSTP or MD PhD students, as we believe the pipeline should be fluid and students should be able to enter and receive support at any level of their training. And last but not least, supporting M3, M4 students with personal statement and interviewing skills. In terms of the outcomes of our program, we have had 4 cohorts of students participate thus far. A part of our first 2017 cohort, 1 matched into ophthalmology residency, 1 mentee is applying to neurology residency, and 1 has pursued an advanced degree in research year and will apply to ophthalmology residency in the future. Part of our 2018 cohort, 2 mentees are preparing to apply to residency and are still deciding on the specialty. For our 2019 cohort, 8 mentees are completing their clinical rotations currently. And for our 2020 cohort, we welcome 2 new mentees into the program this year. We are still in process of surveying all of our mentees regarding their interest in ophthalmology and the impact of the program. So in conclusion, our pipeline program has been successful at matching our first mentee into ophthalmology residency. Our program represents an ongoing effort to increase diversity in ophthalmology and in medicine and build strong residency applicants. And last, we're continuously adapting our program due to the challenges of COVID-19 to better reflect our goals for the future. Here are my references. Thank you so much for listening.